Yeah, we're recording, so whenever you want to start, we can start.
I think we can. Yeah, we can now. It's 6:35 here, so we should do. Mhm. Mhm. Whenever you're ready.
Okay, cool. Hi, everyone. My name is Roz, from Darwin, Australia, and I'm very, very excited to be invited to talk to all of Angeli's beautiful clients who are joining today and those that are joining on the recording later. So my background for probably 15 years, I was a senior researcher in various universities. And then as I describe it to people, I got a dog, and then that just changed my whole life trajectory because I decided that the whole pet industry was not how I wanted it to be for my pets. So I went out and retrained and tried to become as knowledgeable and as skilled in that holistic pet health world as I could. And now I've sort of turned that into an education business because of my background in that, but also I have a mobile clinic and a rehab clinic as well, where we do lots around completely holistic treatments for dogs and cats. So that's a little bit about me, but I'm really passionate about educating pet owners because I really believe that the more you do, the less you need to be taking your dogs and cats to vets. You can become your own expert for your own pets because you spend way more time with them than we ever will. So you know so much more about them. And I think that's really, really important. So I have a list of questions, but I'm thinking what we might do first is see what questions those that are online have, and we can use that to then guide some of the questions on the piece of paper that I've got. So if anyone's got a question in the top of their mind, just turn your mic on and ask away. No question is too big or small, I assure you.
Hello.
Hey, Sammy.
Hi. So I have questions about UTI. So I have a golden doodle, and I was told by my vet that because there's like folding near the vulva that she's just, I don't want to say prone, but that it does happen. She has been getting reoccurring UTIs, and there's kind of just some like black goo that's in that area, and I have to clean her myself like every 2 days. And I was wondering about like so I bought cranberry powder because Angelie had recommended it. And so I was kind of wondering if that's what you would recommend too. And if like I'm trying to figure out the dosage because I bought like just like the human kind.
Yeah.
um so I'm not entirely sure like if I'm supposed to give it to her every day or if that's more preventative than it is something that will just take care of it.
So there's a few things, and I'll probably ask you a few more questions. So that's most likely what's called a hooded vulva, which means it's like sort of a bit droopy, right? So you can't get as much air and things like that in there. That's a simple way of describing it.
Yeah.
Have they ever swabbed it to actually look at if it has what's collecting in there is bacteria, or it's just been described as
I
being?
think I think they did. So I think one of the first tests we ever did was just like a very basic one, like the P test, and then and oh, maybe not swabbing, maybe just a P test then that went into further testing.
Yeah. And do you remember, sorry, this is testing you now, on that P test, was it that she had like stones in the urine, or it was just like it had bacteria in there?
I think it was just bacteria, but I remember last summer she had told the vet had told me that she had seen stones and was a little bit worried about it. And then she went on medication, and then they became a lot smaller and there was a lot less. But she still has that like gooiness around her, and I don't know how many times I need to take in her pee for them to tell me like I need to go on the antibiotics, I think it was again.
Yeah, so there's a few things you could do yourself, and it's not 100%, but you could collect your own urine and go to the chemist and get like a dipstick analysis. Like you can do that at
Okay.
home, right? So you could just see if there's any like out of the normal, then that's like a good indication. Maybe take your pee and get them to do a more thorough test, but at least you're kind of
Okay.
doing a bit of a, checklist at home. And you just need like gloves and a syringe. And just like 1 drop per square on that dipstick analysis. And it just gives you an indicator, like it'll pick up things like pH, specific gravity. It'll check if there's any blood in the urine. And then it's like, okay, they're really good red flags that I might need to then take that and spend the money and get them to run a better test.
Yeah.
It sounds like if it's brown, the discharge, it could be like she could be a bit yeasty as well.
It's like almost a black,
Yeah, like crusty or thick. You said gooey, didn't you?
like
Yeah.
goopy. Yeah.
Yeah.
If
So,
don't clean it every 2 days, but I try to keep on top of it.
yeah. And did they offer you a surgery to like pull that hood back?
No.
There is a surgery called vulvoplasty where they kind of like, it's like what plastic surgery on the vagina. But and it just pulls that hood back basically. But cleaning is important, but I would think about diet as well. So diet to prevent urinary infection. So what do you feed?
Um, what is it? It's like what's it, Mom? What's the food she's on? It's not, she used to be on raw for a really long time, and in the past 2 years we switched. Because she had gained so much weight and our butcher moved. So she's on, I don't know if you know Open Farm.
I've heard of it, yeah.
It's their, what's it called? Gently cooked.
Yeah,
Just
okay.
read it. Sorry. It's called like a stew.
But it's like is it still fresh? It's just lightly cooked. That's okay.
Maybe it's not. Maybe it was the old stuff. I think this is just, it's like there's different flavors. There's like a fish and there's beef and chicken and turkey.
Yeah.
And then it has veggies, it says, and superfoods, it says.
Yeah, okay. And so I would maybe, I don't know what the composition is, but you can always send that through.
Okay.
It might just need zhuzhing of the diet. Like there could just be a few things that are lacking in there that we could optimize for like urinary health. So cranberry can be a preventative, but if it's recurring, it's not going to be a preventative, if that makes sense. Because you're giving something while they've got it. So it's a bit tricky. But cranberry is great. So that was an awesome recommendation from Angeli. So what you want to have a look at though is like it will have a milligram dosage on it. Once we know, like sometimes it's like 60,000 milligrams or micrograms, we can then dose based on the strength of it. And I would probably give it twice a day. But we need to do it based on the strength. Other things I would, and I was just talking to Angeli about this, is like a probiotic spray. So if you clean it right, you're just wiping it out. If you leave any bacterial cells, bacteria is really great at just like replicating really quickly. So then 2 days later, you've just got the same thing there again. So I would be looking at a probiotic topical. So you clean it, that's great. And then you spray a really good spray of a probiotic topical in there. Because the idea is it's this thing going to pump a heap of good bacteria in. So you're going to limit how much bad bacteria is in there. Because it's like a fight, like a good and evil fight. The more good you put in, the less bad that can be there. But if bad's left with nothing to counteract it, it'll just replicate back and you're sort of in a vicious cycle.
Oh, so maybe that's what's happening.
And then I would also consider maybe a probiotic as well. So I would go like a multi-strain probiotic, or you could do like a capsule of Saccharomyces boulardii, which is technically a yeast, but it functions like a probiotic. And like the America and the States have heaps on iHerb that are fine. So they would be my tips.
Okay, thank you so much.
Welcome. Anyone else got a question for me?
So here's the thing. We're talking about probiotic. In that case, should we give our pets like probiotic in like regularly, like maybe once a week or something like that, just to help to their guts to be like working, functioning better?
So I heard a really good analogy from a medical doctor around probiotics, and I've now stolen it because I think it's great. So the thing with probiotics is when we're giving it, we're putting that bacteria in there, right? But as soon as we stop giving it, it's not going to just stay in the gut, because cells change. The food we're putting in can impact that at all. So I recommend like constantly giving some sort of probiotic, but cycling through things like the brand, what strains you're giving is really important. So a lot of brands on the market only have 1 or 2 strains. So then you need to go and find another brand that maybe got some different strains and cycle that through for a period of time. And then like Saccharomyces boulardii can be really great for digestive upset. So you might start with that. So my dogs get cycled through. We have 2 products and that's what I cycle them through. But read the label. Most of them are, only have 1 or 2, maybe 3. So you need to cycle through, because otherwise you're just giving, say, 3 bacteria, when if we look at the microbiome of a dog or a cat, it's got lots of different bacteria and they're not in concentration. So if we give, say, one product that's got 3 strains of probiotic, and that's all we ever give, we run the risk of overpopulating with those 3 bacteria, and that's not ideal either. So what we want to do is try and create a diverse microbiome, which kind of looks, if we colored it, it would look like a rainbow, because there's so many different strains of bacteria there. And they're not, one's not in majority population, they're just all in part of that overall population, if that makes sense. So I do like probiotics, but it's important to understand the strains. So you want a good variation of strains and then cycle that through.
Okay. So yeah. All right. So I think we should go to the alignment, and how do they take care of the pets like at home. So in terms of like the eye, the booger eye, the ear problem, and what's the sign that they should looking for, that there is the indicator of the problems.
Yeah. So if you've got like discharge coming from the eyes or ears or recurring ear infections, I always say the eyes and the ears are the window to the gut. So while we want to solve eye problems and solve ear problems, we want to give some relief topically to the area. Ultimately, we want to figure out what's causing that and not just relieve the symptoms. And that applies holistically as well. We want to eventually get to the cause. I always say it's gut health. So I would really look at diet. So a lot of people nowadays are feeding like really good quality food. But if we've got, for example, and most dogs I believe have this, is like a leaky gut. If they have a leaky gut, it does not matter how amazing your nutrition is, they can't optimize that. So a lot of people then get frustrated and go, but I'm feeding this amazing quality food. Why isn't my dog healthy? And it's because the body can't optimize that nutrition. So sometimes we have to go back to basics and feed a really simple diet plus some herbs to heal the gut, and then transition them back to that nutrition. And we often see better results. So in a nutshell, and I go into it a lot more, that's what I was talking to you about, Angela, in how to heal the gut. But in a nutshell is you pick a novel protein, and novel's just something they haven't had for a long time or for a period of time. So it's quite new. Cook it. So say turkey and sweet potato, and it's a 50-50 ratio. And they're having that cooked for the first week, plus they can have a broth of that bones from that protein, so like a turkey broth, because it's full of collagen. It's really healing on the tummy. And you can build that broth amount up from a couple of tablespoons to, if it's a large dog, a cup per day. So they do that for a week, and then they'll do that essentially for another 2 weeks after that. So 3 weeks. But from week 2, I would start adding in things like some gut healing herbs. So some marshmallow, slippery elm, fennel, ginger, licorice, whatever you can get your hands on, and a probiotic. So I would go more with like Saccharomyces boulardii because it's a capsule, it's easy to give, and give that capsule around 20 minutes before you feed them, because it will go in there, say, hey, something's happening here, and then the food comes in. So it optimizes it better. So I usually do that for 3 weeks, and then come week 4, we try and transition that food from cooked back to a complete and balanced raw meal. And what we tend to see is the dog has improved in health overall, because we've just given that digestive system a chance to slow down and reset. And then the herbs and the broth and things like that have allowed it to heal as well. So some dogs might need to do it for longer, but 4 weeks is a good time that I can get most people to commit to. So that's something to consider. And I think will often help your eye problems and your ear problems. But in terms of topically, so obviously they're irritated. So we need to give them some relief. So I tend to use probiotic spray for the eye and clean them out. So just, wipe them out. You can wipe them out with like some warm, salty water. And then I spray, you can like pull the eyelid down and spray the topical probiotic spray in there. And obviously I come from a warmer climate, and you guys are going into summer anyway. Keep that in the fridge to keep those probiotics in the jar asleep. And then when you spray it, it wakes them up. And so all the good bacteria is actually going on to the dog. It's not being wasted because the temperature's woken it up. So that's for eyes. For ears, it would really depend if something's going on. If it's yeast, then that's a whole different ball game. But again, have a good at-home cleaning routine. So wipe the ear out just with like a swab or some baby wipes or a tissue. Get as much gunk out as you can. You could syringe like a probiotic spray in there, or you could make your own ear cleaner. So if it's yeast, I get 30 mils of coconut oil and maybe 3 drops of oregano oil, and I dilute that down. And then you can drop some into the ear, massage it, and then wipe it out, and it will leave that coating there. Oregano and yeast absolutely hate each other. They're like arch nemesis. So, and there's lots of studies on that, on treating what's called otitis media, so middle ear infections and outer ear infections with that combination. So that's a good, easy at-home fix. Just don't do it if there's any like redness and heat, because oregano is a hot oil and you'll just like create so much heat, it's painful. But if there's no heat, it's just gunky and yucky, and that kind of yeast, then that's my go-to. And you can do that every day for a week, and then you could maintain it once a week or however long that's needed to maintain. But if you've got yeast externally, you have yeast in the gut. So usually the gut needs to be healed. And then if we're going to kill off yeast, it's not that easy. The reason for this is yeast clumps in like, I don't have enough hands, but imagine these clumped in like 5, 10, 15 really tightly held cells. The only way to break those cells is to break the cell wall. Now, the cell wall is made up of cellulose, and the only way to break down cellulose is to bring in cellulase. The dog does not produce cellulase naturally, so we have to bring it in through like a digestive enzyme that contains cellulase. And then once we break it open, it's floating around in the bloodstream, right? And the body, and that can become really toxic to the dog. But we want them to eliminate it through their waste elimination systems. So we're doing the right thing, but I like to give herbs, things like olive leaf, things like golden seal, things like milk thistle, to limit that toxic load on the body. So it's going to eliminate all this yeast. We want to give it herbs to limit the impact on the dog. The dog can feel really lethargic. They can feel gross. That's called the Herxheimer effect. It's normal, but it's not a nice feeling. It's like when you feel like you're going down with the flu and you're lethargic, you don't want to do anything. we want to limit that for the dog, because that's just them eliminating all these toxins. So the herbs can sort of help absorb some of that, make it a bit of an easier process. But yeast is very, very hard to get rid of. It's not a snap your fingers kind of thing. It takes, depending on how long they've had yeast, that's really relative to how long it takes for them to get rid of it. So if they've had it for years, then don't expect for it to go, in a couple of weeks or months. It might take 6-12 months to slowly get rid of it. And that's a good progression, because the dog's body is able to deal with that a little bit easier. That would be my tip for that. I think yeast is probably like a number one thing we see coming through here. And I designed a product for it, but it's not available in Canada. But a lot of this stuff you can just do yourself, from getting like teas of those herbs and making teas out of it and putting that in the food. We know yeast like feeds off carbohydrate, so we want to think about the types of carbohydrates you're feeding as well. If they're ones that will convert to like complex starches and sugars, then that's probably not ideal. But more leafy greens, things like that, can be really cleansing and limit that Herxheimer effect, but also limit the reoccurrence of yeast as well.
That's a good explanation. That's a really good one. Yeah. And how about the brown stuff that usually they come like stain on either the mouth because of their drooling so much, or it's from the eyes that it's just drooling, gooping. So like, how do you?
Yeah, so that's like tear staining. That's what you're. I would always think about maybe liver. When I think tear staining, I often think liver. So again, we can do a lot with just like improving the diet and adding in some great liver foods or liver herbs. So milk thistle is very easily available in most countries. So you could try milk thistle and dandelion. They're my two that are really good for liver. And you could either sprinkle the tea leaves or brew a tea and spoon the tea on there when it's cooled. And then I would also do like the probiotic eye spray as well, because there could be just some discomfort bacteria there. Yeah. For mouth, that's
Nice.
more for me, like that's a cleaning hygiene thing with those really long, like your Schnauz and your Shih Tzu.
Yes.
Yeah.
Uh-huh.
That's just it stains because they're eating their food, they're probably going and rub their face somewhere. So yeah, it comes down to just maybe wiping it so it doesn't build up and get really stained there.
I told them that the stain, that what I learned from stain is from the bacteria that is kind of growing on top of the hair and start growing and turn the color to be brownish kind of. So
Yeah,
that's
bacteria
what
can spread too. And even just having some sort of like antibacterial, antifungal wash, or if you don't want to shampoo that all the time, you could do that just on like a washer and then just wipe on the washer and then chuck that in the wash kind of thing. Or make like a antibacterial, antifungal spritz, goes on the washer, you wipe it, and then you've got your spray bottle that you can use every day kind of thing.
Mm-hmm.
But
Okay.
it does build up,
That's a good tip.
long-haired dogs, or dogs that, have that fur build up, bacteria, and their fur is quite thick or wiry. So it's not, it's quite easy for it to just, grab on.
Yes. Even like I saw the bulldog the other day. Bulldog, they just have like a really
All the
hanging
folds,
lips and the drool. Yes. So that they create a yeast infection.
Yeah. So my tip for like bulldog owners or dogs that have those skin folds is a regular wiping or spraying out. And that can be done very naturally. Lots of people like to use things like cortisone creams and stuff like that. I don't like that at all, because you're actually taking away all things off the skin, and the skin does have bacteria on it. It's very normal and very healthy for the dog to have a topical microbiome, and we don't want to be stripping that down with like topical antibiotics, antibacterials. We actually want to be keeping that microbiome in a good balance. So I like topical probiotics for that reason, because you're trying to advocate that that microbiome has a good diversity of bacteria, not just an overpopulation like in their skin folds of a bad bacteria. So cleaning with natural stuff I do like. So that could just be, what's an easy one? I do like the topical probiotics, but like coconut oil mixed with, what's a nice gentle one? Even just like a bit of lavender. What else do I like?
Or
I think oregano, if it's red and inflamed, is not ideal, but it's okay to use if it's not, if you're using it as a maintenance thing. So you're not at the, we've got a bacterial skin infection or a topical infection stage. You're using it as a maintenance thing, can be amazingly effective. Just maybe go easy on the dilution first. So you might go 30 mils with 1 or 2 drops before you go really heavy on the essential oil dilution.
okay, if just the regular maintenance, do you recommend the the apple cider vinegar for the oil or for the ears, or not really because it's too harsh?
I don't really love apple cider vinegar for that at all, because what I think you're doing is you're just wiping out what's on what you can see, right? The best cleaning strategy is actually to syringe into the canal. That's where all the yuck stuff is, right? What you're just seeing is almost like the excess in those sort of instances. So you could syringe straight coconut oil, depending on the size of the dog. So if you've got, say, like a Shih Tzu, you might syringe like 0.5 ml into the ear and massage it at the base, let them flap, and then give it a good wipe out, because it will have stuck to, and then when they flapped, it'll have drawn some of that stuff in the canal out. That's my preference. What else could you syringe? Is you can syringe like just saline down there. You could syringe like the actual probiotic ear spray. Instead of spraying it, you can syringe an amount down into the ear canal. It's totally safe to do that. Most of like the Otter Flush is what, or Epiotic is the brand that is used in Australia. I just call it like kind of like a glorified saline anyway, that people are paying a lot of money for. But it's fine to do that. And then give it a really good massage, step back, let them flap, and then wipe out. Because what you're doing then is leaving a coating of that good bacteria in there as well. Coconut oils, just most people have it at home because they cook with it, but it does have antimicrobial properties. So it can be something that people have in their closet. And obviously I work with a vet, and she literally carries coconut oil everywhere. And that's how we clean a lot of ears, with coconut oil. So it's not some voodoo thing. We prefer that over just like other harsh, antibacterial, antibiotic sort of, or steroid based things. And it's fine to do maintenance, or if you think you've got like an infection coming, you might up the ante on doing it every day to get on top of it. But I would also be thinking about, why is my dog getting these recurring ear problems? Gut health, gut. Yes, I know some breeds, like especially like obviously dogs that are going to groomers, they probably have lots of hair around their ears or in their ears. And that plays a part, because things stick to that, bacteria stick to that. So it does make things more challenging. But just, getting in there and having a look. I say to pet owners, like every day, you're touching your dog. Always, you're cuddling them, you're patting them, you're touching them, you love them. Swap that for a bit more strategic. If you're patting their ears because they're nice and soft, just, lift it, have a look. What does it look like? You can see all this and probably get on top of it quicker. Just have a little check sheet. So for my dogs, when they get pats and cuddles every day, I always look in their ears. I always look between their paws. I always check their gum color and their teeth. They're the sort of main things. If I think I've observed something during the day that maybe warrants more, I'll go and check other parts of their body. But yeah, you can check their eyes, ears, nose, mouth when you pat them. Subtly, they don't need to be like yanked or pulled. It can just be like a subtle, oh, I'm just going to pull your ear up and have a good look. Or turn the torch on your phone on and see, can I actually see that there's more gunk down in that ear canal? And then when you clean their ear, if they're furry-eared dogs, really like get on the outside, like that inside part where there's fur as well, and give it a good wipe down or spray or wash as well. Because if you coat that with something with antimicrobial properties, when it sits back down, you're going to prevent that too, not just ear canal. So simple things like that can help.
So the nose, because of no one ever come across the nose indicated, because of usually like some normal dog, usually they sweat, if the sweat gland is on their nose. But is the dog nose is dry and crust? What is it telling you from that?
It can be a number of things. I would also like follow that up with like, is there any discharge or like a runny nose or things like that? It can just often be diet. So if they're not getting like a high moisture diet, so like if they're purely on like a dry kibble or something, that is often can just dry them out because it's just they're not getting any moisture in their diet. Often I would say it might even be paired with like a bit of a dry coat, or their coat isn't as shiny. So I'd start there, maybe add some omegas into the diet, but it could be immune related as well. So do they have any lesions on that, or is it just dry? If there's lesions or it's rapidly changing color or pigmentation, that might need a little bit further investigation.
Okay. Yes, because of I groomed the dog so many years, so I saw that sometimes the dog has a dry nose and sometimes they have a crust on top of it. And I tried to remove it, but it's coming back.
Yeah.
I was like, is it indicate the health issue
Yeah,
or something?
It's not normal to be crusty. And I would always say probably the diet needs to be changed. And the diet might have been the same. And that's often the thing too. The diet's been the same that dog's whole life, but we have to change a dog's diet depending on their age and stage. So my dogs in my household are all different ages and stages. And generally speaking, they eat the same food, but their supplementation or the fiber content and things varies depending on which dog. So my more senior dog, he's 13. He's eating the same food in different ratios, but he's getting a lot more fiber in his diet now, just to help with digestion and overall health and things like that. So we should constantly review our dog's nutrition and go, is it right for their age and stage of development and lifestyle too? Are they a bit more sedentary, or we've moved and we don't take them out as much? Well, then we should definitely review their diet to make sure that we're not overfeeding. It's right for what they need. And is the supplementation right? So there's a big like popularity increase in using holistic supplements and things like that, which obviously I advocate for, but I think a lot of pet owners now feel like they have to give like 40,000 supplements, otherwise their dog's not going to be healthy and live forever. But they don't always work together. So you need to have less supplements but be more strategic with them. So like if your dog doesn't have heart problems, you're not needing to give all these heart supplements in hope that they're never going to get a heart problem. Like that's just not really how the body works. But I understand, because lots of people come to me and go, well, this person said this and I have to have all these things to make my dog live forever. Like we just can't control everything, but we should be very strategic in the supplements and be specific to your pet and their lifestyle and their age. So yeah, you don't have to feel like you've got this like supplement regime that's way more intense than yours, because it shouldn't be like that. Food can do a lot, and then we just need to tweak a few, like one or two things maybe for dogs and cats. But yeah, so I thought I would say that because I had a client maybe a month ago and she was giving her dog 72 different herbs across about 15.
Oh my God,
across 15 supplements. And it was not that I had a problem with the supplements, but one, I'm like, that's probably not very tasty for your dog's food. That's a lot. It's like, how much of this is supplements and how much is food? And they weren't actually getting anywhere with the dog's skin health, right? And some of those herbs didn't like each other. So when they're fed together, they're not actually doing what they intend to, because they don't work. They're not meant to work together. So I literally just changed the food and said that they could have 2 supplements. which is easier, right? Otherwise you're there for 4 hours putting all these supplements in that aren't needed. So just, think about that. But review their food often as they enter different life stages or their lifestyle changes. Or if, they have to go to the vet and they have surgery or they have to have antibiotics, then we definitely should review that nutrition and or supplementation so we can optimize their recovery and their return to health.
Okay, so and the next thing is about the food that you touch base. Some dog that eat just a little, but they turn out to gain weight like tremendously in like a small little time. What causing it?
A number of things. So I would be checking with my vet that they don't have like a heart murmur. They don't have any like signs of Addison's or Cushing's disease, any like fluid retention, because little dogs often have those conditions, right? It's very common in those smaller breeds. And it can be fobbed off, but if you want to dig a bit deeper, I'd be pushing for those kind of things. I had a dog recently that I rehabbed her. She was paralyzed, and I really was tough on her food amounts because she wasn't walking, but she needed certain calories, obviously, to help her recover. And then all of a sudden she started putting on like massive amounts of weight. And I knew the owner was being super vigilant with her diet because I monitor that like a hawk. So I sent her to the vet for things like an ultrasound or, just a further workup. And it was fluid buildup from like a chronic heart failure. So when she got on medication for that and we started some herbs, that weight was a bit easier to control because the medication was able to do its job. The heart was able to pump a bit better. So sometimes we need to dig a bit deeper than thinking it's always just weight gain. It is weight gain, but is it something else that we can't see? And fluid, like heart problems, would always be something I would want to rule out.
Oh, okay.
Particularly
so
in
how
old dogs, right? Old, like if they're pushing like 9 and above, that would be something I would think about. And also like bloated abdomen or just more distended abdomen can be things like spleen, but it can also be like Cushing's related as well. So that's where it's good to go and get diagnostics and rule
Can
things.
I ask a question?
Of course.
Sorry to interrupt. Thank you. I have an old English sheepdog. He's almost 5. And we only neutered him when he was 3. And in the year after neutering him, so we went for the checkup after a year, he had gained 30 pounds, but eating the exact same food. So we've
common.
removed a lot of. So is that common to gain that amount of weight? I know he's a big dog, just from being neutered.
Yep. So, okay. And I'm sure you weren't told, right? So you just went back and were like, what? No one told me I needed to monitor this.
Actually, we kind of did know. He is our 3rd dog of the same breed, but we had neutered the other 2 earlier and the weight gain wasn't as extreme. But yeah, I had an idea, but just after you mentioned about it could be other things, I just wanted to double check.
Yeah, so the reason for that is obviously testosterone is a sex hormone, but it also regulates a lot of other systems. And once that testosterone's out of the system, it is actually a weight regulator as well. And because he was 3, he probably had a little bit more testosterone once that waned out of the system. His body wasn't used to it at all. Whereas if dogs are desexed younger, which I personally think late desexing or not at all is the way to go. So if younger, they probably didn't have that full testosterone maturity in their body. So you often see that with younger dogs, if they're desexed early, they haven't actually reached that peak of testosterone production. So the weight gain isn't always as dramatic after desexing because they haven't reached that peak.
I see. Okay. Thank you.
Yeah, no worries.
He's a big boy.
But it's really hard because like, I think that's a real challenge, and it's same in female dogs. It's a real challenge because we have to feed like a caloric requirement that's just like their daily caloric requirement for living, right? And then we have to calculate, well, what activity do they do? How much extra calories do they need without you know, altering their weight or actually losing weight? Because you don't want to put them into a constant calorie deficit, because that's dangerous. So that's a tricky thing for you. I understand that.
Yeah, he is much less active since he was neutered, I will say. So
Yeah.
maybe he just uses up less energy in terms of the food.
Yeah, and the drive, like that testosterone drive isn't there.
Exactly. As you
Testosterone
said.
is the real activity, you know, moderator as well. I have a neutered male. He came neutered from the shelter, and then a dog that I found, and I didn't neuter him. And it's so crazy. Like, he's just always lean. And sometimes I'm like, oh my God, like, you're really hungry today, but you never seem to put on weight. And it's just a good comparison. You can see, I can see that how
True.
that testosterone plays a huge role. So, good question.
Good question.
Thanks.
So you're talking about the age that we have to watch for the food. Like, when should we like start to shift the food from like the puppy to adult to elder?
It
So
depends,
when
it depends on the breed. So if you've got, let's talk about a few different breeds, because that might be a good way to do it. So if you've got a small dog, you know, technically they reach full maturity around that sort of 12-month mark. Maybe not in their brain, and behaviorally, but physically they tend to have had their joint growth plates are now fused and things like that. So around 12 months, I would be going, okay, I'm going to review from a puppy diet now to what we call like adolescent adult diet. But even just like reviewing once a year, because their lifestyle changes, our lifestyle changes, right? And when our lifestyle changes, or however busy we get, so does our dogs, because they're part of our lives. But usually for a small dog, I then probably review again around like 4 to 5, and then like 8 to 9, as we would consider them sort of going into more maturity. But I would review it at any point if there was like a health or an injury, because we can really improve diet to aid in injury recovery. If you've got like a medium-sized dog, it would be probably around that 18 months that they're usually definitely fully grown, have reached that growth plate maturity. If it's like a large breed, like a Great Dane, or what do you have? You've got like Chow Chows are quite big. What's another big breed? Like your Saint Bernards, they're massive dogs, right? I would be saying they're probably not reaching their full growth maturity for around 2 years. And that can be anywhere between like 60 to 100 kilos. They're huge dogs. So I would be feeding them for growth until that stage, and then review to if I'm switching them to like an adult sort of maintenance diet. But big dogs need to be allowed to grow, definitely, because they take way longer. You think if they've got to grow from this to, you know, absolutely enormous. The thing to remember with giant breeds is that growth should be slow and steady. Yep. So weighing them regularly and making sure it's not like a sudden weight gain, because that can cause issues in terms of growth deformities. And also I would be wanting to make sure I'm feeding like complete and balanced, making sure they're getting enough calcium. No matter what I'm feeding, I'd be looking at that nutritional profile, because I think we just feed lots to our big breeds, but we could be a bit more strategic in particularly calcium and phosphorus in that early stage. But big breeds, 2 years, and then I'd probably review probably sooner, like 4 years, 6 years, because they tend to have a shorter lifespan. So the more frequently you review that, you can really see how they're sort of maturing. That would be my suggestion.
Okay, thank you. And anyone has more questions? No,
The list too.
I
So
have a lot of questions.
yeah, we can use, there's some really good ones on this list, which I know people sent
Yeah.
in to you. Let's have a
Yeah.
look. So there's probably like 2 together. So I'll read those out and we'll answer them together. I'll do it once at a time because I think of all these ideas. What medicines are available for weakness in the hind legs? So there is medicine, and then there's obviously natural stuff you can use. If your dog's got weakness in the hind legs, think about age, okay? So is it because maybe they've got arthritis or they've got an injury? But also just because the weakness is in the hind limbs, I also, in the back of my head, my rehab brain thinks spine. Do they have something going on with their spine? If they're like a Frenchie, a pug, a dachshund, a bulldog, any of those breeds that are prone to intervertebral disc disease, hind limb weakness can be the first sign, and we don't even think about their spine. But the reason that limbs or front limbs and hind limbs often go weak if it's a spinal case is because each vertebrae is what we call innervated, meaning has nerve endings that control the motor function of the front and hind limbs. So often if they start going lame or dragging or paralyzed, it's usually on the spine. Or if it purely is a hind leg weakness because of arthritis in the knee or the joint or the hip, I would still think they'd be quite sore along their spine as well. So medication. So collagen can be great if we want to make sure that collagen sheath, around the joint capsule is there. It's also kind of can be a nice shock absorber. Glucosamine and chondroitin, obviously that's what the joints and bones contain. So we can get that from food though. So we could make a really rich bone broth, like chicken feet's packed full of glucosamine. So if you make a bone broth out of that, add it to their food, I would consider that a supplement over necessarily adding that into as a powdered supplement. Feed it as a food. Then we can think about, is it painful or is it purely arthritic? So if it's also painful, then I would be wanting to give them some herbs that help with pain. I like white willow. I like Jamaica dogwood, devil's claw. A whole swag of herbs can be really pain relieving. And then I would also think about their omega. So maybe I would put them on a high dose omega. So we can give omega in their food through things like fish and things like that, and we meet the nutritional requirements. But if we're dosing to help with like joint health, we need to therapeutically dose, which is generally speaking a higher dose. If you just Google, I think it's Colorado State University omega-3 dosing chart. That's like the gold standard for dosing for joint health. And you can find your dog's weight and it'll tell you how many milligrams of EPA and DHA. And that's what I use as a standard formula because I've done a lot of research on that. So it's a printable chart that you can just whack on your fridge. Or if your dog doesn't really change in weight, then you can just search that. Then there are things, it depends what's available in your area too. So if you have holistic vets and practitioners in your area, then there's things available like joint injections. So the vet that I work with, sometimes we inject homeopathic stuff into the joint. Hyaluronic acid can be injected into the joint. There's lots of natural injections that can be given around the joint capsule. Things like prolotherapy, depending if there's an injury there, before I reach for things like Synovan and Baranza. I don't like those personally. And then I would also consider CBD if it's pain related. And CBD can help with multiple things if you've got multiple stuff going on, like digestive problems, skin, it can help with skin. So they are the kind of go-tos that I reach for. But there's thousands of herbs out there. So it's a matter of sort of picking what might be relevant or working with someone who knows how to pick the right herbs as well. For pain relief, because obviously a lot of what I deal with in rehab is pain relief. I do a lot with herbs. So Chinese herbs, which I love, like what I said, white willow, devil's claw, Jamaica dogwood. Some of our patients don't actually go on like pharmaceutical pain medication. We get enough pain relief with herbs, and we dose PEA, so palmitoyl ethanolamide, which is a natural compound from food. We compound it into tablets. So we have a 300, a 600, and 1,000 milligram of that, and we give that for pain relief. And that's an over-the-counter. And we drained a dog's ear the other day. So that was really painful for the dog. And that dog went home on PEA and Chinese herbs for pain relief. We didn't give it anything pharmaceutical, and that's a painful procedure. And that dog was, happy. So they're all things that you can actually get over the counter or online, and very pain relieving. I love PEA if it's dosed properly. It won't be pain relieving if you're not dosing it properly. So you're looking at about 10 to 20 milligrams per kilo to dose that therapeutically. And PEA can help with skin, but I personally haven't seen amazing things with chronic skin problems, but basic skin problems, yeah, it is effective. So that's that first question. The second one is the dog is having difficulty standing from a sitting position and is challenged navigating stairs. So naturally stairs are challenging for a dog because it really changes their loading. So if you think about, I'm just going to use my phone as an example. If you think about going up, the weight's shifted backwards going up the stairs. But then if they're going down the stairs, it's pushing all their weight forward through their front legs rather than a nice distribution. So if they're carrying anything like arthritis or injuries, or they're just carrying a bit of stiffness and soreness like we do, it's pushing all that weight, and it can be really uncomfortable. They don't want to navigate the stairs. So I'm an advocate as if you don't have a huge dog, and you don't have a huge set of stairs, you could build a ramp, or if they're little dogs, carrying them up the stairs, because a lot of injuries happen or are exacerbated by stairs purely because it's just changing that weight load so dramatically. If they're having trouble getting up from a sitting position to a standing position, I would have a look at, are they sitting nice and square, or do they have like that lazy sit? And you'll know where they kind of like flop the leg out or flop it in. They're not sitting up nice and square with a nice straight back. Have a look at also, is their back sort of a nice sort of gradual incline? Or can you notice that they're sitting forward, they're sitting back, they're just not sitting like all the other dogs you've seen that look normal, right? Usually there's pain somewhere there. I would say if they're not wanting to get up from sitting to standing, that they have very, very sore hips or elbows, and it could be that they have hip or elbow dysplasia, hip or elbow arthritis, and then they're going to have secondary pain through their like lumbar spine. And often dogs will change their sit and not want to get up because it's really hard and it's really painful. So your first point of call would be to try and manage the pain, and I would try that naturally. And then some massage along the spine. I bet you it's really tight along the spine. If they don't have like any known injury, I would more opt that it might be arthritis, but x-rays will confirm arthritis too. And arthritis is super painful. So before we start doing things like physiotherapy to help get them from sitting to standing, or hydrotherapy, or any sort of rehabilitation, our number one goal for the animal should be to manage their pain. Because no one's doing anything. If you think about yourself, you're not doing any form of rehab if you're painful. You're going to go, I'm just going to let this, pain go away, get my pain under control, and then I'm going to go to the physio and get exercises and things to do, because it's way too uncomfortable, way too painful. And we don't want to make things worse. So pain management is key. And if you're working with a physio or a rehab vet or whatever, that should be the first thing they do, is pain management first. And that's a whole, like I said, it's a whole swag of things, from omega-3s to CBD, and then you've got it as they get older, potentially into your pharmaceuticals. But a lot of my clients don't end up on pharmaceuticals. They're managed as best as they can, or it's more end of life, they'll go on to pharmaceuticals. So that's my goal for my clients, is less is better.
Can I ask a follow-up question?
Of course.
So when you're talking about CBD, do you look for different CBDs for different issues, like for anxiety versus like arthritis? Is there like something specific that you look for each condition?
Now, I'm not an expert on CBD. I use it, but it can only be prescribed by vets here, whereas it's freely available in, I guess, in Canada. I know it is in the States. I would be looking for quality is important. So I'd be wanting sort of organic, and then it's to do with the concentration. So whatever CBD you're buying, it should have like so many milligrams per mil, so we can then dose it properly. If it doesn't have like a concentration, in my opinion, it's probably just hemp oil. So that's important. So you might need, if you've got a larger dog, you're probably going to need a stronger concentration. Otherwise, you're just going to be going through a lot of CBD. It's to do with dosing, right? So it should be dosed so many milligrams per kilo, and then working out the concentration will give you like a dose rate, if that makes sense. Then there's things like, which is not available here, normal CBD, generally speaking, won't contain any THC, but there has, which is what generally speaking makes dogs high or people high. It's got that element to it. But they're like, in the human world, THC is also used for pain management. So I know that holistic practitioners and some holistic vets in the States also use THC in addition, like as a separate, in a separate bottle, you can buy a THC as a combination to manage pain as well. So it's not a straightforward answer, because it varies from country to country what you can get, but it should be dosed to weight. So the one thing I will explain about CBD is when you get it, or whoever dispenses it or whatever, you don't just dose them at their maximum dose rate, right? You need to think of it as a bell curve. So you start them at like a minimum dose, and then you need to slowly, over the course of like a week to 2 weeks, gradually increase that dose. And you'll hit a sweet spot where you go, oh, my dog is doing pretty well. That's where you stop, right? And that's where you keep them. And then you have playroom, that if you go, oh, now I don't think that's so great, I can keep increasing that. Oh, we've hit another sweet spot. Because if you go over that sweet spot, you've lost the efficacy of the CBD, and you're just flushing money down the toilet. So it's got to be done gradually till you hit the sweet spot. You've got an adjust range, and then most dogs sort of maintain on that.
Okay. Because I have a sheepdog also, and she's very anxious in the car, and sometimes at the groomer. And she's sweet, but she's just anxious. And I've tried for her before, but I think I started at the max, and it didn't seem like there was any difference. So I'll try that. Thank you.
Yeah, try that. And then there's good herbs for anxiety. And then is she like, she doesn't like getting in the car, or she's fine to get in the car, and then once she's in the car,
no problem. She lays down, I put a bed in there for her, and then we start driving, and she's like vibrating.
Yeah. So
sometimes
does she
goes to
salivate?
bed, but
Does she salivate when
Wait,
is she salivating?
I don't think so. No, she's panting.
So she could be nauseous.
Oh.
So I would, I know, but dogs get motion sickness. And so I would think about too, like, I know it's hard filming driving, someone else film while you're driving, or at least try and sort of really observe the body language, because it could be nausea rather than anxiety. Not saying that it is, I haven't seen your dog, but don't underestimate how many dogs get motion sickness.
Okay. Okay, thank you.
And if she's prone to ear infections, then I'm going balance, all sorts of things could trigger.
Not that one.
Okay, there you go.
The other.
But we're narrowing it down slowly. But yeah, don't rule out nausea.
Okay.
Any questions, or I'll read the next one off the list and we can go from there. So the next one is best supplements to promote healthy skin and hair. So I would always say, before you go down the supplement regime, I would look at their diet. Is it as optimal as it can be? If it is as optimal as they can be, do we have some gut problems going on where that nutrition isn't being optimized in the body? And then I would think about simple supplements like omegas to improve skin and coat, and maybe they have a zinc deficiency. But again, we kind of probably should test for that before we supplement zinc. And then I would maybe they need some herbs, but generally speaking, it's probably herbs to heal the gut, because if they've got optimal nutrition, they would probably have, and they're absorbing all that properly and digesting all that properly, they should have good skin and coat. If they've got skin problems, I still come back to food and the gut. That's always my starting point, is really unpack their nutrition and only supplement if we need to. And usually I'll start with gut supplements, because if they've got a good diet, then you're doing great. It's just the dog can't maximize the benefit from that. So we've got to allow the dog to do that. Okay, then this is like a whole different question that's come through. So we're going like, oh, the other end of the section. This is how to treat fear aggression. So I'm going to unpack this a little bit. So I have a greyhound, and greyhounds are known to be fear aggressive or resource aggressive and sleep aggressive. They can have really aggressive tendencies. And I got one of the best for that. So the thing to remember with any form of fear and then aggression that stems from fear is that the animal kingdom is not built on right or wrong. The animal kingdom is built on feeling safe or unsafe. So when we've got a dog in a state of fear and then they're resorting to aggression, they're completely in a state of feeling unsafe. So think about what is happening in their environment that makes them feel very, very, very unsafe. Okay. And that's likely going to be more than one trigger, right? They've probably been trigger stacked, and they may not have been trigger stacked on that day. It could have been happening for 3 days. So an example might be that dog spent the weekend at home, okay? And the postman came, Monday, Saturday, Sunday, right? And the dog was barking at the postman. So that didn't make the dog feel great, produced lots of adrenaline and cortisol. So we add some tickets to the bucket, okay? And then maybe some small kids walked past the house and, screamed at the dog. Okay, that added a few more things that made the dog feel uncomfortable. And then maybe the dog was in a small confined space and felt like it couldn't move. And then that bucket just completely filled and the dog exploded. So we have to think about triggers, not in that moment, but what also happened leading up to that. And that could have been days, it could have been weeks. And when we get aggression, like when we get any emotive response from a dog, that is like encompassed with a hormone response. So emotions are basically a giant cloud of hormones of how that dog is feeling at the time, but also what the body was doing at a hormonal level leading up to that moment. So if you think about that from a human perspective, I might go and get in the car to go to work now, and someone honked at me or, drove fast, or I got held up, and all these things just sort of culminate over the day. And someone was rude to me at the shops, all these things. Then I get home and my husband says, "Hey, how was your day?" And I just explode. It's not him, right? It's just that my cup has built up over a period of time, and it's an easy outlet. So with fear aggression, you need to look at what are the triggers, and we need to remove those triggers to start making the dog feel safe. So safety is paramount. And I mean safety in terms of they have to feel comfortable. It's not necessarily our safety, it's the dog's safety. So what is really triggering that? And then put in management steps to start making that dog feel safe. And then if this is aggression in relation to maybe grooming, then we need to rebuild that dog's trust. Okay, so you can mitigate all the aggressive triggers and make them feel safe. And then if you try and repeat that behavior, the dog's going to be aggressive again, because you have to recondition them to build that trust over time. I don't be afraid of something and then the next day I'm not afraid of it, right? I need to learn that it's not going to hurt me. It's going to be okay. We need to do that for animals too. That's how they build relationships. That's how they understand the world. So positive reinforcement over time. But if we continually re-trigger them with the same triggers, you're just going to go around and around in circles. But also, even in aggression cases where there's like clearly a behavioral thing there, I would be thinking about pain. So a lot of dogs that all of a sudden become fear aggressive have chronic pain, like chronic pain. And I don't want anyone coming near me if I'm painful and touching me. So that's something really important to consider. And I would also think about diet. You know, is there anything that they're eating that isn't optimal for their health that could be painful? So I've seen fear aggression cases too, where the dog was just on like a really crappy diet, had like chronic gas, basically. We improved the diet and it was felt so much better. So it's not always a behavioral thing. The behavioral is like the outcome, but it's not why they're doing it. So I'm always really hesitant to send or say a dog should go and see a trainer for behavior modification if we haven't really ruled out any health related things, particularly if it's come on. I usually would say it's a health problem first, and I would always go pain 100%. So if there's any follow-up questions to that, fire away. Otherwise, I'm just going to quickly read the next one on the list. Oh, this is a good one. Are grain-free diets unhealthy for dogs? Are they just a trend? I do think they're a trend. A lot of people are feeding grain-free. So there has been some studies around grain-free diets being linked to dilated cardiomyopathy. That was probably 5, 6, 7 years ago now. So whole food grains can be really valuable in a diet. It's just whether they're needed for that dog, and also the quality of them. I don't think dry food can provide quality grains. And if you read even the grain-free, if you read the ingredients on a lot of grain-free kibble, it is crap. There's nothing really particularly nutritious, or it's very, very hard on the dog to absorb and get nutritional value from it, in my opinion. But we could feed whole food things like not that it's a grain, but example of like quinoa, amaranth, oats can be really beneficial to some dogs. I would never feed corn. It's just like low hanging fruit. But some dogs I do put on like a denser carbohydrate depending on the health condition. But in terms of grain-free kibble, I think your money's better spent elsewhere. Okay, we've got a whole swag of questions and we're nearly at the end, so I'll endeavor to answer them. This is a good one and we get this a lot as well. My dog is a regular grass eater. Why and how can this be stopped? Okay, so don't stop it. It's normal. And a lot of dogs don't have the privilege of eating grass, especially like if they're apartment dwellers and things like that. So often you'll see dogs that live in like apartments or units will go looking for grass, and then we think it's excessive. But dog that has open access to grass will probably munch on it once or twice a day. It's normal. So normal because the grass might be shooting and they'll eat a part of the shooting leaf of the grass that's really high in protein. So that's normal. Dogs doing normal dog things. They can eat it as a way to purge. So if they're feeling like they have an upset tummy, they'll eat grass and it can either make them vomit or it can either make them defecate. And that's normal because it's going to help push that out. Again, totally normal. If they're doing that in like excess. So we had a dog, I saw a dog recently because I'd done a post on grass eating, and this lady contacted me and she's like, my dog is like way off the spectrum of grass eating. And I was like, no, I bet you she's not. Anyway, I called her up and I said, like, what do you mean by like way off the spectrum? And she's like, we go out for a walk and we don't actually walk because the whole like 45 minutes she's eating grass. And I was like, okay, that is not normal. So we did a bit of digging and I was like, I want to try and watch your dog poo. I want to look at, you know, what that poo looks like when she comes out. Is she nauseous? Is she vomiting? She's like, well, she's not nauseous and she is pooing, but the poo was a bit mucusy. It was a bit inconsistent. And the food was amazing. So we put her on some tummy herbs and a probiotic, and that subsided the excessive. She still eats grass normally, but that was excessive. But that was also because her tummy sounds were just like, it felt like she was like, had a radio in her stomach that you could hear. And the herbs really settled that and optimized how she was digesting as well. So that's an example of normal versus definitely not normal. But it is not something that you want to stop. If you think about when you have a upset tummy or you feel nauseous, you'll probably take something to make you feel a bit better. That's just nature's way of letting dogs self-medicate. But if you live in an apartment, because that's very common these days, and you don't have access to grass, I do recommend that you could have like some pots that have grass in it. You can have pots that have parsley. You can have pots that have mint, like a few range of herb, lemongrass. So dogs have something to go out onto their veranda and chew on in between, and that can help as well. But it can also be really therapeutic on their tummies. So that's a fun thing you can add on your balcony. Provides green, but it's also medicinal for dogs and cats too. So that's a good one. Okay. Oh, two good questions. All right. Most dogs develop fatty tissue masses. Masses can be harmful to dogs' health. Should they be removed? So fatty tissue masses or lipomas, generally speaking, well, it's up to you if you want to remove them. But you can do herbs to help reduce the size of the mass. And I have found that really effective. Obviously, if that fatty mass is like, you know, impacting mobility or pushing up against an organ or something, that was when you may consider removing it. But what I heard, again, this was a human doctor that gave a really good analogy around tumors that I shared with my husband, because I was like, this really encapsulates my view, my personal view around removing lumps from dogs. So when you've got like a cancer, all those sort of cells, like the body does a great job of bringing all those cancer cells into one spot, into one lump, and then the rest of your body, arguably the cells are normal. Okay, this is like a really simple explanation of it. So here is like all the bad cells, and the body's done a really great job of bringing them all together. But if we remove that, then we essentially could be like just distributing in that surgery those cells back throughout the body, which we know can happen because surgery can trigger hemastases, which is where they spread and then it grows again. So I like that analogy, and the body is doing its great job of bringing it into one location. So you might opt for a more holistic treatment of that. And, you know, being in Canada and the States, there's a lot of vets that do really cool holistic cancer treatments. Obviously, for me, the decision is on also the age of the dog. So if you have a senior dog that's all of a sudden developed fatty, non-cancerous lumps, I don't think the risk outweighs the reward, personally, for my dogs, in putting them under a general anesthetic and then removing them, because they could grow back, the anesthetic, and it's quite a long procedure depending on how many lumps there are to remove, and recovering from that, where they are, will the wounds heal, because you're also then dealing with wound healing as well. So that's my personal opinion that I've sort of decided on for my dogs. I've seen a lot of dogs have surgery and then voila, you know, a few months later, the lump's back. So you're then back in for another expensive surgery. So my approach is always to try something a bit more holistic and natural first, and then weigh up my options as to whether it's working, what's my dog's quality of life, etc., etc. I saw a question come through the chat box, so I'm just going to have a quick read of that. Okay, cool. Luca is a unneutered male bowerable mastiff, 2.5 years old, and he's got yeast. Yeah, beautiful big dog. Nice. I would first, Joe, I would start and have a look at diet. There could be a few things in the diet that are just feeding the yeast. And then we talked about this at the beginning. So we've recorded this so you can go back and listen to. I would do a gut healing protocol. So really simple, pairing the diet right back, cooking the food, and hitting him with some gut herbs and also some herbs to kill the yeast. So I talked about, and you can go back and listen how hard yeast is to break down, and having a protocol to break the yeast down. It's tricky, but that would be my starting point. And then also if you've got, if it's topical, you might need to think about some topical relief for the yeast. And also when you've got yeast externally, you've definitely got it internally, but yeast will take time. If it's 2.5 years, I would say give yourself a good 6 months to try and get on top of yeast. Start with diet, maybe some gut healing herbs, and we definitely need to kill off that yeast in a nice, gentle way, which will take some time. But you can always email us. We do have a particular yeast course coming, because I reckon that's like 95% of cases in Australia. But yeah, just flick that recording back to that section, so that'll help as well. And then I've got, how do we treat pancreatitis holistically? So again, pancreatitis is way more common these days than even 5 years ago, I reckon. So the thing with pancreatitis is everyone is often that it's triggered by fat, too much fat in the dog's diet. And sometimes that can be the case, that the dog is eating too much fat, probably too much of the wrong types of fat. But pancreatitis, and I've seen a number of these cases with the rehab vet that I work with, can be triggered by intervertebral disc disease, where the particular vertebrae that's damaged is also over where the pancreas is, and that can trigger pancreatic episodes. So that's something to keep in mind if you've got an IBDD dog or an arthritis dog, and they all of a sudden get this pancreatitis where their whole life they've never had it. I'd be looking at that correlation between IBDD. But treating pancreatitis holistically is a really good quality diet, where I probably would keep the protein probably around 10 to 15% of in the diet, and the fat under 10%. And that's not like total body weight, where you, that, what they mean by that isn't, we plan out their diet and then we work out all the ingredients, what total fat is in that whole diet. So someone can help that. Or if you're buying a pre-made, it should be on the label, the total fat and the total protein. And then you can just calculate it based on the weight. I also recommend some herbs for pancreatitis. It depends on the dog though as to what herbs, but Chinese herbs, a combo called Simao San is amazing for pancreatitis, really, really effective. And then many other Western herbs can be used as well.
Dylan, come here.
And some dogs, maintain on that for life, or they just do a round of herbs. And once you improve the diet and stabilize them, no issues again. So that's a really good question. We have 6 minutes and I'm out of questions on the list. So if anyone's got a couple of questions, we can round out the time with that. Oh, I've got a chat question. All right. Okay. Jasper, cool name. We've tried seasonal allergies, tried cider point, bee pollen, coconut oil in his food. We've considered switching him to raw. So chicken can be a food intolerance, but if he's got seasonal allergies, it probably isn't the chicken. So I would do that gut healing protocol that I talked about at the beginning of the webinar. I would 100% switch him to a balanced raw food diet, but I would do the gut healing protocol first because I guarantee the allergies are poor gut health, because when we understand what the gut does when there's an external allergen in the body, that's why we always heal the gut. So I would start with that. Okay. And then keep a bit of a diary, or you've probably got this in your head. When are the allergies worse? Like what season, what month does it just become too much? And then we want to actually start a supplement or herbal protocol, probably like 3 or 4 months before that time, so we can prepare the body for allergy season, so it has less of a reaction during allergy season. So I do that every year. I have a dog who literally, if we don't control his allergies, he loses everything on his face. It's so red, he's basically skins his face. And I will not do cider point or any of that. I just don't believe in it. So what we do is he has a meticulous diet, and he's super healthy the whole year round. But I know there's particular plants that come in our wet season that he does have seasonal allergies to. So in August, so 4 months before I know those plants are due to shoot, and I live on a very large property, so I can't remove those plants. 4 months before those plants, shoot up through the ground, I start him on like histamine sort of natural supplements like quercetin, bromelain, and some herbs. And I also start him on some prostate support herbs, because the allergies in his body also make his prostate enlarge. And the traditional method for enlarged prostate is to castrate a dog, but I know that that's how the hormones work. So we start him on that combination of things, and we get through allergy season, no worries. So it's about knowing when they start to start your supplement protocol, and then just absolutely get on top of your nutrition as well. So the gut healing would be my starting point for you, and that's also a really nice gentle way to convert a dog to raw, because that gut healing protocol is a cooked protocol, and then we transition them to raw. So that's my go-to. I'm going to send the recording link to Ashley, so she'll send it out to everybody. And I'll just add to that, we've got a little ebook to give you with some raw food recipes and a bone broth recipe and things like that. And then an extra link that you can sign up to is I'm speaking on the 10th of June at a holistic dog nutrition workshop series, and there's about 20 other speakers. You can just go and register, and you'll get the link, and you can go watch those 20+ recordings for free about dog nutrition. So that's kind of timely as well. So you'll get access to that as well. So I've got 2 minutes, so if we've got one last quick question. Otherwise, time flies when you're having fun.
Yes. So if no one asking, I want to ask, what's causing the bad breath, even though the dogs still have good teeth? And how do we fix that? And how do we do an oral care for the dog?
Good question. So in Chinese medicine, halitosis is the window to the gut. So I would say you've probably got poor gut health. Again, it's like a broken record, but gut health in dogs is just phenomenally bad. So gut health, and then oral hygiene is like some people brush their dog's teeth, and I know that's the gold standard, but there's no way in hell I'm brushing my dog's teeth. Bones, I love bones, variety of bones, different sizes for the different sizes of the dog, target different parts of the mouth. Nature's toothbrush is my go-to. If you brush your dog's teeth, hats off to you, that's fantastic. Don't stop that. I have 3 large dogs, and it's just not an option for me. I opt for bones, and they've never had dentals. And then, but you could do things like you can get topical probiotic oral dental sprays, which is going to control bacteria, which is really useful. And then overall diet. If they have good teeth, they're not going to build plaque up and things like that as well. Because you're not getting like that starch buildup that things like kibble and that do. Kibble doesn't clean teeth. Dogs are single hinge jaw, they do not masticate. And you watch a dog chew, it's crunch, crunch. It's not like a cow, right? Like we do. Single hinge jaw, so get them on the bones. And a good quality, like if you look at like a fresh food, they just can't get that bacteria buildup as well. That would be my go-tos. But gut health, window to the gut, that's that's been a Chinese medicine principle for a long time.
Thank you. So I think we should, it's time, the time has come, and I think it's 8 o'clock now, and we have to let the doctor go to her, because she has work after as well. She opened her clinic soon.
You're so welcome.
Oh.
Thank you so much for having me, and I will make sure all the links and recordings and everything get sent through later today once they download, and all the ebooks and everything we discussed. And then you can find us on social media. I share lots of videos about health and stuff as well. So and also I know that Angeli has been sharing some really good tips like the cranberry and stuff. So ask that, because lots of people have knowledge in that as well. So keep that up, Angeli. That's awesome.
Thank you. Yeah, that's all I do, right? It's like, it's not just about grooming. We need to know a lot of things, because we saw a lot of problems. We are the first defense for the dog, right?
I wish more
Because of
were as proactive as you. So I think that's really that your clients are lucky that you're so proactive. So that's awesome.
Oh, thank you. Yes, we try.
All right, everyone, have a good rest of your Sunday, and hopefully we'll see you soon.